Someone suggested that the hospital had just admitted a pair of twins with a rare double mutant cardiac tumor. Whoever could cure them first would be the true owner of the paper. Just as she used her superb skills to make the initial incision, her stepsister followed the exact same surgical steps the next second. The cutting angle and the control of bleeding were identical. Her stepsister smugly said this experiment was the result of 6 months of her own research. Seeing that the woman's plagiarism was about to be proven, she calmed herself and quickly thought of a counter-strategy. When she saw her fiancé and stepsister exchanging affectionate glances, she realized her experimental data had been leaked by her fiancé to her stepsister. Using the previous treatment methods would certainly fail. She had to come up with a new plan immediately, so she decided to use the special suturing technique her mother had taught her. Unexpectedly, her stepsister also knew the secret. Her stepsister announced in advance that she would use her own invented suturing method to close the wound. The woman couldn't understand what was happening. In the end, her stepsister completed the surgery first. Everyone believed the woman was indeed the plagiarist, but the woman did not give up. She thought that since her stepsister was following her steps exactly, she would falsely claim that a piece of gauze had been left inside the patient's abdominal cavity, and see how her stepsister would respond. Her stepsister was extremely worried when she heard this. The woman pretended she was going to reopen the patient's abdomen. Her stepsister, anxious, said she needed to apply for another surgery. Everyone did not understand why a second operation was needed when the surgery was already complete. Her stepsister explained that although the surgery was done well, for safety's sake she still wanted to check again. The woman immediately showed a triumphant expression, because her stepsister had fallen into the trap she set. After her stepsister opened the patient's abdomen, the woman removed her gloves and said she needed a break. Her stepsister became frantic, because without the woman performing surgery, she could not copy her. At that moment, the woman calmly began to dance. She thought that since whatever she did would be copied by her stepsister, she would do nothing at all. No matter how the audience insulted her, or how the patient's blood pressure dropped, she continued to do her stretches. Her stepsister was terrified at the sight, because she had only watched the suturing once and couldn't remember the steps. Faced with so many eyes, she couldn't just abandon the patient, so she pretended to faint to escape the surgery. Watching her stepsister collapse, the woman chose to continue suturing. There were 3 minutes left to finish the competition. The woman had to come up with a new suturing method, so that her stepsister would have no way to copy it. But just as she thought of a new plan, her stepsister suddenly stood up, and announced in advance that she had developed a new surgical method. When she learned that her stepsister's new method was exactly the same as the one she had just conceived, she was stunned, unable to understand how her stepsister had stolen her new plan.